The VA Ann Arbor healthcare system is implementing a new change, one that will benefit Toledo veterans. Communications Chief Chris Arbino with the Toledo VA Clinic joins us to help us learn more about this new electronic health record system. Good to see you, Chris.
Good to see you too. Yeah. Thank you.
Okay, so let's start at the beginning here. The VA is in this region is based in Ann Arbor. That's where the hospital is. Give me an idea of the whole network around here.
Right. So our main hospital is the Lieutenant Colonel Charles S. Kettles VA Medical Center. That's based in Ann Arbor. That's a level 1B complexity hospital. We do a ton of services there, but on the outlying part of that are our outpatient clinics, and we are extended all the way up from Flint, Michigan, all the way down to Findlay, Ohio. So we have a long, skinny corridor that runs through Northwest Ohio and all the way up into parts of Southeast Michigan. That's the VA Ann Arbor area.
I know in the last year they've really tried to work hard from Washington to try to improve VA services, quicker, less wait times,
sure,
better services. What have you seen? How on a day-to-day operation, how have you seen changes there?
Sure. Yeah. So to give you a little bit of context, last year about this time, Secretary Collins came through our area and said, in the vein that you're talking about, to improve veteran health care, one thing that we're going to do is standardize our electronic health record. And so that's what I'm here to talk about today, is that electronic health record. Right now, the VA is, for the most part, on a system called CPRS, and it's been around since the late 80s, early 90s. And also, the Department of War is currently on this new electronic health record. So the VA is a little bit behind the Department of War, and it sort of makes sense when you think about what the patient population is going to be for the Veterans Affairs coming from the Department of War, to have a standardized healthcare record from the DOW to the VA.
I mean, in the private sector, we work with computers and we try to keep all the modernization, and it makes perfect sense.
Right.
The government falls behind all that.
Right.
It's good to see the VA kind of catching up on that. So
sure.
The new electronic health record, why is it being changed?
Yeah, so again, talking about CPRS a little bit, it's a dated system. It works well for what we need it. VAs are able to customize and piecemeal what they need to do with it. Some of the issues we see, even between the VA, is that sometimes one VA CPRS has difficulty talking to another VA CPRS. And so there is a huge need here to standardize across all VAs, and we are actually fortunate here in Northwest Ohio and Southeast Michigan. All of the Michigan markets, Battle Creek, Ann Arbor, Detroit, Saginaw, we all go live with this new record on April 11th. And so we are part of the first wave of VAs that are going to implement this new electronic health record, and the entire VA, the enterprise, will have this new EHR by 2031.
Well, in this transition to some of the services you currently have are going to be kind of going on hiatus, a little bit of slowdown. Let's go over that a little bit.
Yeah, sure. So that's what we call the ramp down, ramp up period. And pretty much every VA provider has to learn this brand new system. It's a huge undertaking. We have been working on it for a full year. It's this all-encompassing project for everybody. And so at one point, we are still doing veteran health care because we still have to take care of our veterans.
Sure.
But for staff to learn, we need to start pulling back some of our appointment availability as we go through the ramp up, ramp down. So right now we are ramping down. There are fewer appointments available in VA Ann Arbor. As we get through the summer months, those appointments will start becoming more available again. We're leaning on our community partners to help us out.
We have a graphic to show you, to give you, if you're watching, you're a veteran from home, this gives you an overview of all the different slowdowns, pauses they call it, and it's going to be, in the long term, some changes that'll be really, really great for our area veterans. How many veterans would you say this area services?
So VA Ann Arbor by itself has just over 80,000 veterans that we serve, from Flint all the way down to Findlay, Ohio.
And of course, a lot of ages too, all the way from Gulf War veterans.
Right, yeah, you know, to someone that was getting their DD-214 today and getting out of the military and wanted to enroll with us. So that person, you know, theoretically could be 22, 23 years old, all the way up to Vietnam veterans. Vietnam veterans are still our biggest patient population within the VA.
They are for honor flight too.
Yeah,
you know,
right.
there's still a wait for about a year or two to get these guys on there.
Right.
But we want to make sure that everyone gets a priority, because we're veterans. We just can't thank them enough for what they've done.
Right, yeah. So, you know, just three big things I wanted to touch on with that graphic.
Yep.
A, we talked about the appointment availability. B is the prescriptions. We're encouraging everybody to get their prescriptions for There we go. Yeah, there's your prescriptions right there. So one thing I do want to point out with the prescriptions, they pause April 7th, they resume April 13th, but
Okay.
that only applies to you getting your prescription online. Prescriptions are very important to veterans, to patients in general, so they can still call, they can still walk in and get their prescriptions. We just want to highlight that it only applies to the VA mobile app that will be offline from the 7th to the 13th.
It's great to see the VA getting modernized, and
Yeah.
it's a win-win thing for all the veterans.
Yeah, I think so. It really does make a lot of sense. Again, the Department of War already has this implemented. They are full go with this right now. It makes sense when you think about our patient population that you have one streamlined healthcare record from the time you join the military all the way through your entire life when you're a veteran.
Chris, thank you so much for coming in today.
Awesome. Thank you.